Skeletal muscle relaxants. Chapter 18. Neuromuscular blocking agents are paralytics or muscle relaxants. They can be non-depolarizing or depolarizing. They cause muscle weakness or paralysis, and are usually given by IV. Three main NMBA uses are intubation, surgery, and managing mechanical ventilation. 6 specific NMBA uses are acute respiratory distress syndrome, status asthmaticus, which is a severe bronchospasm, certain ventilator modes, status epilepticus, neuromuscular toxins, and tetanus. 5 NMBA use factors are: will it react with current medications? The procedure duration. Is quick intubation needed? The route of elimination. And the cost. 4 NMBA risks are nosocomial infections, muscle weakness, pressure sores, and blood clots. 3 things to monitor during NMBA use are alarms, hypoventilation, and hypoxemia. 3 things to monitor after NMBA use are to measure voluntary muscle function, measure hand grip, and the 3 breathing exercises, which are spontaneous respiratory rate, NIF or negative inspiratory force, and vital capacity. 4 benefits of NMBA use are decrease normal breathing, prevent tube dislodging, decrease O2 consumption for patients with bad heart, and improve patient ventilator sync. Non-depolarizing agents can be reversed by increasing ACH at receptor sites. 5 non-depolarizing agents are norcuron, zemuron, pavulon, tracrium, and nimbex. 3 reversing agents are mestinon, prostigmine, and tensilon. 3 issues with non-depolarizing agents are pancuronium causes tachycardia and hypertension. Atracurium causes bronchoconstriction by causing a histamine release. Inadequate ventilation may cause hypoxemia or hypoventilation due to paralysis. Depolarizing agents are shorter duration and have no reversing agents. Fasciculation happens, then paralysis in 60 to 90 seconds with a 10 to 15 minute duration. They are ideal for intubation. The only depolarizing agent is annexine or succinylcholine. 6 issues with depolarizing agents are tachycardia, hypertension, bradycardia and hypotension from repeat doses, muscle pain, intracranial pressure increase, and malignant hyperthermia. CNS drugs. Chapter 20. 8 drug types to know are analgesics, which are for pain relief, anesthetics, which depress nervous system, antidepressants, which alter the levels of serotonin and norepinephrine, antipsychotics, which primarily affect dopamine, anxiolytics, which is a minor tranquilizer, cholinesterase inhibitors, which allows activation of acetylcholine by blocking cholinesterase, mood stabilizers, which are for primarily bipolar treatment, and stimulants, which increase brain activity. Drug roles. Antipsychotics will increase dopamine. Cholinesterase inhibitors will improve function and cognition in Alzheimer patients. Anxiolytics will reduce anxiety. Sedatives will depress CNS arousal. And hypnotics will induce sleep. 3 main antidepressant classes are tricyclic antidepressants or TCAs, monoamine oxidase inhibitors or MOIs, and selective serotonin reuptake inhibitors or SSRIs. The SSRIs are the first line of treatment for major depression disorders. 3 main mood stabilizers which are primarily used to treat bipolar disorder are lithium, which is the only one without sedation side effect, anticonvulsants including valproic acid, carbamazepine, gabapentin and lamotrigine, and antipsychotics. 8 lithium effects are tremors, cognitive slowing, hypothyroidism, renal insufficiency, leukocytosis, polyuria, polydipsia, and possible coma if given a toxic amount. Bipolar disorder is alternate episodes of depression and mania or hypomania. Mania is at least 1 week of elevated or irritable mood as well as at least 3 other symptoms, such as inflated self-esteem, decreased need of sleep, distracted or rapid thoughts. 3 sedative indications are to manage fear and anxiety, more comfortable mechanical ventilation, induce sleep. Anxiolytics are used to prevent a short-term experience turning into a permanent memory. The main type used to treat anxiety is benzodiazepine. Benzodiazepines are sedative, hypnotic and anxiolytic. Can be used to stop seizures. Some examples include Valium, Ativan and Xanax. And a reverser drug is Romazicon. Barbiturates are the oldest group of sedatives. They have 3 uses, which are as a hypnotic, seizure control and for anesthesia. Most have been replaced by benzodiazepines. 2 hypnotic barbiturates are pentobarbital and secubarbital. These have a limited use because of quick tolerance buildup. 1 seizure control barbiturate is phenobarbital. And 3 anesthetic barbiturates are thiopental, thiamyl, and methohexidyl. Ethyl alcohol is a non-prescription sedative and hypnotic. The toxic blood alcohol level is 400 to 600 mg per deciliter. And chronic drinkers that stop abruptly may have delirium tremens or DTs. DT's effect on CNS can be hyperthermia, increased blood pressure, muscle twitch, hallucinations, and seizures, and if they occur there is a 5–10% mortality rate. The Ramsey Sedation Scale. Level 1 agitated, anxious, restless. Level 2 calm, cooperative, oriented, tranquil. Level 3 responds to verbal stimuli. Level 4 brisk responds to light touch. Level 5 unable to be assessed, which is paralyzed. Pain is subjective. It is usually measured with a 0 to 10 scale or a smile to frown face scale for children called the Wong-Baker rating scale. The 2 factors that make pain are the sensation of pain mediated by the CNS and the suffering or negative emotional response to the pain. The 5 main drugs for pain are nonsteroidal anti-inflammatory, acetaminophen, opiate analgesics, anesthetics, and local anesthetics. Nonsteroidal anti-inflammatory or NSAIDs treat moderate pain. Salicylates such as aspirin are the oldest class and a common component in cold medicine. Issues include gastric irritation and ulcers as well as renal injury from prolonged doses. Acetaminophen treats mild to moderate pain. In large doses it can cause liver necrosis, and an overdose can be treated with oral acetylcysteine. Opiate analgesics treat moderate to severe pain. They contain opium derived from the poppy plant. 6 opiate drugs are morphine, Demerol, codeine, oxycontin, hydrocodone, and sublimase. 3 main opiate receptors are mu, kappa, and delta. Anesthetics reduce ability to perceive pain and are used on critically ill with an IV. 2 main anesthetic drugs are diprivan, also known as propofol, ketamine or ketamine. 3 phases of anesthesia are intro, create appropriate level of drug. Maintenance, keeping anesthetized state. Termination, time to recover. 4 factors of which anesthesia to use are the patient's medical condition, which is the most important, age, organ function, and the disease being treated. Local anesthetics are applied to stop pain in a certain area. Subcutaneous lidocaine is applied during sutures or amal removal. Xylocaine is a spray used for bronchoscopy. Conscious sedation is when the patient is still conscious but has no pain. The drug normally used is Versed or midazolam. 4 uses of conscious sedation are outpatient procedures, endoscopies, colonoscopies, and minor procedures.